There have been tremendous advances in understanding pain, not only as it occurs in arthritis, but in other conditions as well. We have to think about pain, and what is it? Well, pain is the symptom that our body is using to tell us that there's something wrong. There's something wrong in a different part of our body, such as the heart or the lung, but certainly it occurs within the joints. And an important concept that has to be understood is where exactly is that pain coming from? Because quite interestingly, in the different kinds of arthritis, like rheumatoid arthritis or osteoarthritis or fibromyalgia, the pain can be coming from different sites, from different parts of the joint. Now, breaking the pain chain was developed in order to have patients be able to get the information, the basic facts, so to speak, about pain and what the mechanisms are in the body of how the body processes pain and how the body responds to pain when it's occurring. When we think about pain, we have to think about it in three different categories. One is the pain generator, in other words, where the pain is coming from. What part of the musculoskeletal system? Is it coming from the joint itself? Is it coming from one of the structures around the joints, like the muscle or tendon or one of the lubricating sacs, the bursa? We then have to look at how the pain is processed in the nervous system. How does that message get sent to the brain? And then what happens to that message? It turns out that messages from the pain generators go to different parts of the nervous system in the brain, and there are effects that happen. There are messages that go back to tell the area that that pain should be inhibited or stopped. There are messages that go to our hormone system, our endocrine system, that can influence how much hormones are produced. There's certainly messages that go to the front part of the brain where the emotions are added to the painful stimulus. So that all of those activities are very important, because breaking the pain chain, which is a 4-part series, takes a look at the different aspects of pain and how to manage it. It takes a look in the first section about the mechanisms involved with pain and explains how pain occurs in different types of arthritis. So in the second part, we talk about treatment, about how to target different parts of the nervous system and of the pain pathways in terms of treating pain. The third is to look at nutrition and exercise and look and understand the role of those two factors in pain control. And lastly, to look at how pain affects our emotions, as well as how it affects our sleep. Throughout each of these different sessions, we are intending to empower people. We want them to be the ones in charge. You know, I ask each of my new patients, I ask them who's in control, who's in charge. You know, over half the patients say, well, doctor, you are. And I tell them this, I say, an important thing to remember as a patient, that they are in charge. They are the captain of the ship. They are the ones who are controlling really the activities. Significant others in their lives are the first mates, and we, the healthcare professionals, the doctors, and other members of the team, we're the navigators. We help that whole process, that ship to sail in the right direction. And that's what breaking the pain chain does. It gives patients the basic facts about pain. It helps them to understand what the effects of that pain are on their body, and then talks to them about what can be done to help best manage that pain. This is an empowerment of the patient. And so that all of these advances that can be made, that have been made in understanding pain, really can be applied best to them. To look at the generating factors that are involved with the pain and treat them most specifically. You know, the Arthritis Foundation's mission is for help and hope. And it helps to inform patients, their families, and the community about arthritis and about what can be done. Breaking the Pain Chain is a program that certainly will help in this process to help the patients who have the over 100 different kinds of arthritis better understand and then better manage their problem.